Hey everyone, Daisy Andrea here, and today we are going to do some exercises for some low back pain relief. I know a lot of you do experience low back pain, and these are going to be some simple exercises that you can do every day or when you're feeling a little sore and achy to help with your back pain. Now, as with everything, I like to start all of my exercise with some deep connection breathing, which connects your whole core and pelvic floor. Now, the core and pelvic floor are more than most people think. It includes the diaphragm, the muscles of the low back, the muscles of the abs, and also our pelvic floor muscles. And the purpose of the connection breath is to put all those pieces together so that our body is speaking to each other. Now you can do this seated or laying down. If you're further along in pregnancy, seated might be more comfortable for you. If not, you could certainly do this on the ground, laying flat on your back, knees bent, may be a little bit more comfortable for you. But you do want to make sure that your body is stacked on top of each other and you have nice posture where you're not sticking your chest out or your back is kind of rolled under. And that may depend on where you are in your progression of pregnancy. So what you want to do is, again, get into position. If you are seated, you want to make sure that you kind of remove the extra tissue on your bum. Lay you kind of more flat. As you can see, I probably sank down about an inch or two as I had kind of sat right on my sit bone nice and flat. So for those on the back, definitely make yourself comfortable. If your back is sore, you may want to lay back with your knees up. So as you inhale, you want to open up the ribs, open up the belly, let everything open and expand. Ribs kind of come up, diaphragm comes up, and exhale, everything comes down. You want to feel the connection all the way up through the diaphragm, down through the pelvic floor. We're just going to do 10 of these today, nice and easy, something that you should be doing every day. And as we go through our low back exercises, if you can work the breath with the exercises, that is ideal. So we're just going to inhale and exhale. You might be able to feel the movement a little bit better by placing your hand on your abdomen and just under your ribs. So we're going to inhale and exhale. Good, that's one. And inhale and exhale. Inhale and exhale. And inhale and exhale. Inhale and exhale. And inhale and exhale. Got a friend today. Inhale and exhale. Go in your bed. Go lay down. Inhale. Exhale. And I lost track, so we're going to do 2 more. Inhale and exhale. And hopefully you can really feel the pelvis engaging in this motion, especially if you're sitting down. You should really feel like everything is coming up and then back down. All right, let's just move along to the next exercise. Again, if you have, I would really suggest 3 times a day doing 3 sets of 10 of your breath. What will happen with that is it'll become natural to you and you'll be doing it every day in all your activities. It's really great to prepare you for birth, labor, and then after birth for all your healing, so we can get back to some of these exercises. All right, so let's get started. So we're going to start with a pelvic tilt. I'm going to use the ball here, And hopefully you've got one too. Now transitioning from the connection breath to getting on the ball is actually really great because you want your pelvis, again, sitting right on the ball there, moving the tissues. And then what we're going to do is we're just going to flex the pelvis and then extend. And we're going to do 10 of those. We're going to do 1, 2, 3, 4. Make sure you use your breath with this one. You can inhale here. And then exhale, open up. Great. Nice and loose. We're going to do 3 more of these. 1 and 2 and 3. So that's your pelvic tilt there. And the more you can incorporate breath with that, the better you'll be. The next thing I want to do today is going to be hip circles. Now, hip circles are great standing up, but you can actually also do them on the ball. And you can really get some good range of motion by doing them on the ball also, and really accentuating the movement. Now, if you have trouble balancing, then you can certainly stand up and do some circles. So let's do 10 circles. We're going to do 1, 2, 3, 4, 5, 6, 7, 8. Really open up the back. 9. And that is 10. I also would like for you to go in the other direction. And if you want to use your arms too, you can kind of get the whole motion going. So you can do 1, 2, 3, 4, 5, 6, and I like to squeeze my glutes at the top, and that gives a little bit of extra little workout for the glutes. And I got 1 more for you. There you go. That's 10. Alrighty. So on to what I like to call thread the needle, and you're going to do this both on your right and your left side. And you would like to get into as much, you can either get on your knee or you can get on both feet, depending on how far along you are and how comfortable you are. But threading the needle is actually a great way to really rotate the back. So you're going to take your upper hand and you're going to thread it just like a needle between your arm there. All right, so I'm going to do 10 on this side, 10 on the other. I'm going to go on my knee here. But you are, if you can do on both feet, prop yourself up, then you're actually going to get more of a workout on this. But my back is a little sore, so I am going to do this on my knee, and I'm horrible with balance. So we're going to do 10. We're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, and there's 10. Other side. All right. Here we go. And then you do really want to watch the lineup of the shoulder and the arm. You really want to try and make as much of a straight line as you can. And we're doing 1. Inhale. 2, 3, 4, 5, 6, 7, 8, 9, last one, whew, 10. Really feels good. Try and get as much rotation on that one as possible. Really enjoyable exercise. I use that regularly. Now we're going to do the cat and cow stretch, which really allows that spine to kind of open and just, you know, it's really a great opening exercise. So you're going to get into your hands and knees if you're comfortable with this. Hands flat on the ground, in line with the shoulders, hips also in line too. You can spread the knees also too. But the idea of this is you're really going to arch the back and then open and extend the chest. Okay, so we're going to do 10 of these. You're going to inhale up and exhale, arch that back. Inhale up and exhale back. Great. Inhale, exhale. That was 3. And we're going in for 4 and 5. 6, 7, 8, 9, last one, and 10. All right, hopefully you're warm already. So another one we're going to do is a variation on like knee rolling or knee twisting. So you're going to lay flat on the ground, and the goal is to create a little twisting in the low back. So you're going to bend your knees, and then you're going to bring the knees to one side and then the other side. So hopefully you can see me pretty well. Knees bent. Again, try and keep posture all in alignment. And you can start either side. I'm going to bring down to the right first. And as comfortable as you are, do as much twisting as you can. You can bring your arms out to a T position. If you need to bend your knees higher, that's totally fine. If you do have a larger belly, you might need to bring your feet closer to the ground. So we're going to do 10. So that's 1, 2, 3, exhale. 4, inhale as you bring your knees down, and 5, 6, 7, 8, 9, and last one, 10. Excellent. That one was really good, and you can pretty much do it anywhere. And I really find that for low back pain, it really kind of opens up that spine, takes some pressure off the pelvis too. Really great. All right. So what we're going to do now is just a stretch. We're going to hold it for 30 seconds to a minute. And what you want to do is you can either do this on the ball if you are a little earlier on in pregnancy. Otherwise, have yourself seated. Stack your spine, so nice posture. Roll back your shoulders, and you're just going to bend the knee, and you're going to put your ankle on your thigh. Now this opens up the low back muscles and also glute muscle called the piriformis, and it really allows that to stretch. So what you'll do, ankle again as close to the thigh as you can. If you're not as flexible, if you needed to bring further down the leg, depending on your low back or your comfort level. totally fine. So I'm going to put mine right about the middle of my thigh here, and I'm actually going to push down on my knee a little bit, and that will further progress the stretch. And so you're going to want to inhale through the stretch and also exhale. And inhale and exhale. Inhaling and exhaling. Inhale and exhale. Let's switch sides. All right. Now, I can already tell you might have one side that is tighter than the other. That's totally okay. So this, I'm unable to go as high on this side as the other. So I'm just going to adjust as necessary, and I probably don't need to push as hard on this side. This muscle's a little bit tighter on my left. All right, everyone comfortable? We're going to do some inhaling and exhale. And inhale, back nice and tall, and exhale. And inhale, and exhale. Inhale, and exhale. Inhale, and exhale. Great stretch. All right, let's move on to our final exercise meant to help with our low back pain. So this one is a hip flexor stretch. Now, a lot of times the hip flexor is kind of right in the front of the pelvis and goes into the front of the quad there. Now, what happens is if this muscle is tight, a lot of people get a little bit of rounded or low back. So especially when you have a belly, pushing your center of gravity a little forward, this muscle tends to shorten, and then so you can develop low back pain from that. So the goal of the hip flexor stretch is to open up that hip flexor, open up that pelvis, take some of the pressure off the low back. I am going to do this in a lunge position, so knees on the ground, and I'm going to bring one foot forward in a 90-degree angle. And the more you lean forward, the more you're going to feel a stretch along the hip flexor right through here. Now also opening and putting the hand up will also open up that muscle a little bit more. And holding this also for about 30 seconds to a minute, depending on how comfortable you are. And breathing in and exhale. And inhale. And exhale. Inhale. And exhale. Inhale. And exhale. Great job. So now we're just going to switch sides, same exact movement. Might have to move over a little bit for you to see. Again, this is the opposite leg of the bent knee is the muscle that you're working. So this is what you want to mentally engage, mentally think about as you're inhaling and exhaling. So let's start again. I like to put my arm up to kind of increase the stretch there. So we're going to inhale and exhale. And inhale and exhale. Inhale and exhale. Inhale, exhale. Inhale and exhale. Great job. All righty. So we did a couple exercises there for the low back, and feel free to start the video again, maybe do 2 or 3 reps. You know, try and work up your stretches to, you know, up to a minute if you're comfortable. But thank you so much for joining me today. Any questions? You can certainly email me. Check me out on my website, www.strongmoms.com. Thanks.